Well, hello, everybody. This is Kyla Newland from Mountain Pacific Quality Health, and welcome to our weekly series, It's Worth a Shot. Today, we're going to be talking about some questions about the bivalent vaccine and also highlighting some drug disposal methods and promotion of the National Drug Take Back coming up this coming Saturday. We can go to the next slide. So please, as always, add your topics and questions in the chat, or feel free to come off mute if you have questions during the presentation. And we will continue to meet at the same time every Wednesday for a half hour. And we are going to do some polling questions. What best describes your facility's approach to obtain vaccine history? We appreciate your feedback on these so that we can tailor continuing educational opportunities focused on areas that you need assistance. So it looks like we have kind of a tie right now for immunization information systems and hospital records. Looks like about half the folks have voted. I'll give it just another minute here. I see somebody commented in chat, if it's not in the hospital records, they check with family, resident, or primary care providers and pharmacies. Good, thank you so much. All right, I think we can go ahead and end that poll. Thank you. And do we have one more polling question, Mary? I guess that was our only polling question. So many thanks to everyone for attending this educational session every week. We really appreciate your engagement and your feedback. We'll go ahead and go on to the next slide and we'll look at our flu status numbers for the week. As you can see, and as expected, this time of year, we are seeing those numbers tick up quite a bit. We're seeing primarily influenza A, that's the yellow. And so just a reminder for everyone to get their flu shot and stay healthy. Next slide, please. So just a quick update on the Novavax, which is the protein subunit vaccine that came out, I don't know, probably 6 months ago or so. So previously for booster doses, the bivalent was primarily recommended, but this week they actually came out and said that for folks that may not be able to get an mRNA vaccine because they've had an allergic reaction, or for some reason they don't have access to that as their booster dose, they can get 1 dose of Novavax 2 months after either the completion of their primary series or their last booster. So Novavax is an option as a booster dose for those 18 and older. And this is a change. Previously, only the bivalent booster was recommended. You can go to the next slide. So I'm just going to go through kind of the top 10 questions that we've been getting about bivalent vaccines. So we can go to the next slide. So what does bivalent mean? I know when this first came out, there's a little bit of confusion as to whether this was a combo vaccine, potentially with flu and COVID, but that is not what the bivalent vaccine is. It is actually a dual COVID-19 virus combo with half of the original strain that we saw with our original COVID epidemic and the BA4, BA5 that is currently circulating primarily. Who should get the bivalent booster and how many doses are needed? The answer is a bivalent booster is indicated for everybody 5 years and older. if it has been at least 2 months since the last booster or primary vaccination series. Next slide, please. When should a patient get a bivalent booster, which was kind of in our last question, but you have to be at least 2 months out from either your last booster dose or your primary series. And if you've had COVID-19 within the last 90 days, you may decide to wait 90 days from either the positive test date, if you were asymptomatic, or the date symptoms started to get that bivalent booster. So instead of the 60 days, you can wait up to 90 days. But that is not a hard requirement. That's just a recommendation from CMS. Next slide, please. So can we get the booster shot and the flu shot together? Absolutely. They have shown no increased risk of side effects. The only exception to that is if you get one of the higher dose vaccines or one of the adjuvanted, which are the ones that are recommended for patients 65 and older as a preferential recommendation to get one of those particular products. They do show a slightly higher risk of you having that injection site soreness. And that's likely just because you're getting more than one vaccine on the same day. And those vaccines have been shown to be a little bit more effective. And that's why they are primarily recommended for those 65 and older, or preferentially, I guess. How is a person up to date? So up to date status. There are different recommendations if you want to use, there's actually a booster tool that tells you, you can put in your doses on the CDC website and it'll tell you if you're considered up to date. So there's a few factors to consider: your age, the vaccine you received, the length of time since your last dose. And it has kind of simplified the recommendations for those that are immunocompromised, because before it was like, okay, how many booster doses or additional doses do they need? And now they just flat out need to get that bivalent booster 2 months after either their last booster or their primary series. We can go to the next slide. So if a person under 50 years old has had 2 boosters less than 2 months ago, but they are not the bivalent, are they considered up to date? And the answer is yes, they would be considered up to date until after that 2-month period has passed, and then they would no longer be considered up to date until they receive the bivalent vaccine. So as far as side effects, very similar to what we saw with our initial mRNA vaccines: fatigue, headache, muscle joint pain, chills, nausea, and vomiting, usually only for a day or so. Risks of myocarditis as well as clotting and anaphylaxis are also very, very rare with these vaccines. Next slide, please. So are there training opportunities? Yes, there is a Pfizer training. We have the link here. And that is specifically for Pfizer vaccine. So check that out. And more information, of course, CDC up to date, like I mentioned. If you go to that staying up to date page, there is a booster. When do I need to get my booster? Kind of a tool that's really helpful. And I think that might be all of our questions. I did also want to mention that last week we had a couple follow-up questions that we have not forgotten about. We had our presentation from a surveyor, and she wanted to follow up and escalate those questions to the level of CMS contacts. So we are still waiting to have answers to those questions. They were regarding some masking requirements and up-to-date requirements. So hopefully we'll have the answers for those next week. And I think, unless there's another slide of mine, that I will turn it over to Jessie. Unless there's questions. Are there any questions in the chat?
Yeah,
yes.
Kyla.
I see if a resident is due for the second booster, should the resident receive the bivalent instead of the regular? Absolutely. It is preferentially preferred. The monovalent boosters are no longer recommended at all. Does that answer your question?
Is that with the exception of the Novavax update?
Correct. Yes. So now adding Novavax to the mix as an option, and that would be for anybody who's received any of the series prior. So if they received mRNA, Pfizer or Moderna, or if they received J&J, or if they received primary with Novavax, they can get the Novavax as their booster or the bivalent version, but no longer the monovalent version is not recommended.
Thanks, Kyla. And it does sound like on some pharmacy calls that I participated in this week that pharmacies have ordered some Novavax and have increased the quantities that they had previously. So you may very well hear that you have that option to get Novavax to help vaccinate your staff from your pharmacy.
Okay, yeah, that's good information. Thank you.
Looks like there's another question in there too. How often do they need to get the bivalent?
So that's a really good question. Right now, it's basically 1 dose of bivalent or 1 dose of Novavax as your booster. And as we move along and we see how long that immunity is lasting, there might be further recommendations, but as of now, it's just that 1 dose that's recommended.
Thanks, Kyla. I know that question's come up quite a bit, so no repeat of it at this point, but stay tuned. Is there a site that can assist in looking for vendors to vaccinate residents? Yes.
Yeah, there is a location of vaccine finder. I can post the link to that.
Yeah, and remind me, is it Simbri? Are you in Wyoming, Simbri?
No, I'm in Hawaii.
In Hawaii?
Yes.
Okay. Okay, yeah, we can, Kyla will post a link and then I will, if you want to put your email in chat,
Okay.
I can
Will
look
do.
for some resources that are local to you too. There might be some mobile pharmacies in your area.
Okay. Thank you.
Yeah,
Yeah,
absolutely. So I see the CDC, another comment, the CDC has made a point to say that mRNA bivalent boosters are recommended over Novavax monovalent, but people can get the Novavax. Yeah, they recommend, if somebody really has a reason, if they have an allergy, if they have a history of a bad reaction to an mRNA vaccine, those are the reasons to get it. But you are correct. Thank you.
and I see Simbri and I see Michael, your email address. I'll reach out to you guys individually and see if I can get some information for the area you're in, and we'll locate some resources for you. And Samantha, you too, absolutely happy to help. And Kyla,
I see
yep,
another question. If a resident just completed their primary doses, they can go straight to getting their bivalent booster, and that's absolutely correct. And then I think that's it for questions. Keep those coming if you have them come up.
Yeah. And if anyone else in the Hawaii area, or really anywhere, any one of our listeners online right now, if you guys need extra assistance aligning vaccination resources, mobile clinic options, long-term vaccine planning, please drop your email address in the chat box, and I will reach out to you and we'll do what we need to do. We are here to help. Yep, yeah, no problem, Simbri. All right, so we thought we'd just take a moment to oh, here's another question for you, Kyla. A couple more.
Okay. Have there been more concern regarding the myocarditis? They haven't seen an uptick in cases, but they did see some cases of myocarditis when they studied Novavax. So I wonder if it could be just because that's being used more frequently, but I have not heard that specifically, Julia. And have you seen many residents recently with positive COVID tests after receiving the bivalent? I'm gonna defer maybe to Marcy or Jesse on that one.
You know, I cannot say that I've seen any. You know, it depends on the test type really that they're taking. Carol, let me see if I can find some information and data on that. Okay. Yeah, let me see if I can find some more resources and data on that. That's a really good question.
Yeah, and I'll also put in our Q&A for next week to research myocarditis and see if there's any data coming out about that.
And Anna makes a good comment. The vaccines, you know, they're not a live virus. So you, if you're using the, let's see, anyone who is POS positive after vaccination would have been infected from an outside source. Yeah, so again, yeah, Kyla and I can work to find some resources and information and share that forward. Good questions, very good questions. All right, if you think of anything else, feel free to drop it in the chat. So we thought we'd take a few moments and talk about National DEA Drug Take Back Day and proper medication disposal tips on the back half of our presentation today. Next slide, please. So October 29th is our National Take Back Day, coming to a location near you. I just like to remind everybody that these take back events, these programs, they're really designed to be a free and anonymous program where you can take prescription and over-the-counter solid dosage medications like tablets and capsules in for proper disposal. And, you know, I've received some messages privately over the last couple days that, you know, hey, I know someone that wants to take medications in, but they're worried there might be repercussions. They have 3 bags of medications because their mom saved them up over the years. And I just want to convey the message. This is an anonymous disposal method within our communities. And it's really to encourage safe disposal of medications. You don't have to sign anything. You don't have to acknowledge you're dropping anything off. You just drop it off and go. So again, there's this option in our community around the country right now coming up this weekend, this Saturday. So please feel free to share that message forward. Thanks. Next slide, please. So with that, I thought it'd be kind of interesting to take a look back into how the spring DEA National Take Back event totaled out as far as collection sites. So you'll see in our serviced areas, Hawaii, Guam, Alaska, Wyoming, Montana, we have multiple sites throughout our region. And I will point out something interesting when I looked at this map. Anyone that has friends in North Dakota, I think that they have some unique pharmacy laws or maybe some resources that are unique to their state, but they definitely stick out when you look at the collection sites compared to the rest of the country. Next slide, please. So when we look at total weight collected from this last spring's event, it was nearly 360 tons. And again, we look at our Alaska friends, our Hawaii, Guam, Montana, Wyoming friends, and you can see the utilization of those take back locations in getting those unwanted medications kind of out of our communities and safely disposed of. Again, looking at North Dakota, I see the 0, so they kind of stick out a little bit. Next slide, please. And when we look at all-time totals, since they've been counting from the first DEA Take Back Day, pretty interesting to look at Alaska leading that effort. And again, Hawaii, Guam pretty close by, then Montana and Wyoming. Next slide, please. So, again, when we look at those totals, why is that important? Because we have this opportunity to dispose of medications properly annually. And it's a public awareness announcement and something that we can do to help our communities to keep medications out of our water systems and perhaps the hands of those that those medications are not intended for. And those all-time totals that progressively grow after each event, I think that we're doing a great job sharing that message, and there's definitely a benefit to continue to share that message. Next slide, please. So in addition to the DEA Take Back Day that are offered on an annual basis, we also have additional options for disposal in our communities that are year-round options. And those may include police stations or local pharmacies, perhaps your health department. There's also some disposal systems, and there's a couple options from some manufacturers that I wanted to share forward with you guys today. doTERRA is doing a campaign that is called Gone for Good for the month of October. And if you get on their website and you're on the website, I'll say it's a little bit tricky. And I know our Alaska and Hawaii friends, you've heard from me the last couple days. Montana and Wyoming, you can get on the doTERRA website and order your free pouch for medication disposal for the month of October. Hawaii and Alaska, I sent you an email this morning with contact info to reach out to receive your free samples. You just have to do it a little bit differently. And if you need that information, again, just put your name in the chat and let me know that you need the Gone for Good campaign information, and I can connect you with those resources.
Well, and Jesse, just to add to that, for Alaska, our state has a program where they will disperse those as well. And I can put that in the chat, the link, if you wanted to order disposal bags directly from the state in Alaska, and they just happen to be the doTERRA brand as well.
Yes.
Yep, I'll put that in.
Thank you, Kyla. And then there's another product too that's available over the counter, RX Destroyer, that, again, another option for year-round disposal of unwanted medications. You can get RX Destroyer online at rxdestroyer.com, as well as through a variety of retailers, including Amazon. If you are looking to either one of these products, doTERRA or RX Destroyer, for maybe your healthcare setting and would like to buy in bulk, when you reach those manufacturers, they also have bulk discount and pricing. But these products are nice, and it's just an optimal time to share these forward because you can purchase these. They're designed in such a manner that once you utilize them, they can go back in the normal trash. They don't have to go in a biohazard. There is some specific manufacturer guidelines for use that you would have to be mindful of. But in general, these are great resources to share forward. Also, Walgreens has a It Ends With Us campaign, and any Walgreens now throughout the country, if they don't have a medication kiosk for returning or disposing of medications, then if you go to the pharmacy counter, they will give you a free package of Dispose RX to dispose of your medications on your own. And essentially what that is a powder that you would mix with water and with your medications that would also be approved to go into the household trash. So again, Walgreens across the country, they have those kiosks, and if there's not one in there, then they have Dispose RX free of charge. So just a public service announcement. And a good reminder to spread awareness of our resources in our community. Next slide, please. And these take back programs and long-term care, oftentimes I'm asked, the DA take back program is wonderful, but how can we use that within our long-term care setting? What impact can we have in making that connection with that resource? And I always take the opportunity to remind folks that this is a community program that we could incorporate into educating our families on safe disposal options of unused medications, perhaps incorporate into our education of our discharge planning education with our patients and our residents. And ultimately, the one that always sticks with folks is, we always have those families that come in with bags of, these are my meds from home, or these are my meds from home for my mom or my dad or my loved one. What do you want me to do with these? And this is, again, an opportunity to share that we have take back programs within our community, whether they're year round or the National DEA Take Back Day, that would be a viable and safe option for families to dispose of medications. So just a public service announcement. And next slide, please. So here's a list of resources. These slides will go out with next week's reminder. And next slide, please. And on that resource slide too, I'm sorry, we did embed locations for proper disposal based on your region. So there is links in there for Montana, Wyoming, Alaska, and then the DEA Take Back flyer for Hawaii. And as always, feel free to reach out if we can assist. All right, any questions? Had some great questions today. Did we catch them all?
I think so, Jesse. I've been watching.
All right. Well, as always, thank you everyone for attending. If you think of anything, feel free to reach out. If you'd put your email address in the chat box in need of vaccine assistance for identifying access in your area, I will follow up with you on an individual basis. And same place, same time next week. Thank you, everybody.
Have a good rest of your week.